Okay, we're going to go over Module 14, Managing Information. It's page 127 in your book, Chapter 14. So here's your need to know words. We're going to go through them, but the first thing I want to do is show you the care plan that we've talked about and the flow sheet, and that's where we document on. Um, Okay, so here is a care plan, home health care. It's an aid care plan. Yours will be similar if you're doing home care. So, and this is also one of the activities that you'll have to do in the modules. But to go over it, here's their name, their information, a little bit about them. She had a CVA. If you don't remember what that is, Google it. Okay, so that's a stroke, a cerebral vascular accident, and then she fell out of the shower last week. So we're looking at shower safety, reminding to use the walker, assist patient to walk with walker from door to mailbox every day. And then over here are some of the things that you'll do. She's on a low salt diet, and you will have to prepare and serve the meal. Okay, and body mechanics, what you'll have to do, assist her, help with range of motion exercises, anything that's checked off. So it's a lot of check off. So we'll shower her, we'll groom her if you look at these things. Shampoo only once a week. We're there every day. We're going to assist to the toilet. What kind of homemaking? Because if you're doing home care, you're expected to do light housekeeping. And so clean the bathroom after use, clean the kitchen after meal prep, and then a little bit other things of safety issues that, we made this up, but remind and encourage to use walker, assist in and out of shower, infection control, wash your hands while with the patient, and then other things over here, special instructions every week. Ask patient when was last bowel movement. Report if no BM, that's a bowel movement and that's a way we say defecate. Did she poop over 3 days? Because then they're going to give her or suggest do a laxative. So it depends if we're working in home care and how, even though it's non-medical, they try to help people with these things. Um, and what are we going to do? We're going to look in the shower, observe for skin, observe skin for any bruises or skin breakdown. So that is a care plan. And it's similar for home care as it is for if you're a certified home health aide. The difference is once you get your CNA and your certified home health aide, the insurance is paying for it. And so the insurance usually does not because they're doing medical things. So they don't have you prepare meals. You're usually in and out of there. You give someone a bath, shower, check their skin, do pericare, and you may be done instead of staying the whole day. Again, for home care, so this is when we were saying care plan, and also they say plan of care, depending on where you're working, but it tells you what you're supposed to do. And next, I'll show you the flow sheet. Okay, so here's an example that goes with the care plan. They call it an aid activity note, but books, as yours does, we usually call it flow sheets. Flow sheets, even in the hospitals, it's kind of a check off, things were done, or a date that they were done. So in here, um, you would put, let's say you came on a Saturday, you'd put the date, the time in, the time out, and then you check off all the things that you've done. All right, and then there's often a place for caregivers' comments, right? So on this certain date, there was red warm discoloration on left lower posterior leg. And you know what? You can describe it the best you can. The most important thing is that you reported it to someone. Now, it may not be an RN. It may just be the agency because this is non-medical care, but you still have to report it. Okay, so this is the flow sheet where we document. The other one is the care plan that we looked at what we're supposed to do. Okay, so I also want you to know that there are most of the documentation is often done on little apps on the phone. So here's an example, and you have to keep going through pages, and your home care agency will provide you with this. But like on this one, did you complete this task? It was a task before. Um, did, to do, walk with client. Did you complete this task? And then you just check off yes or no. And just know that information goes automatically back onto the computers at the agency's desk. In the modules, there's activities, so you see more of this app and how it works. Okay, so the objectives you could read essentially it's why do we chart? Why is careful observation important? And some of the guidelines going with that to know those. All right. So we have to be really alert to changes in the client's condition. So if you're a caregiver or if you're a CNA or a nurse, the whole the way I look at it is here's a person that's compromised a little. That's why you're there, right? They're not independent. And we're trying to prevent other problems, right? Trying to get them healthy. So, but part of that is being observant beforehand before problems get bigger and bigger. Okay. Or does it slow down their recovery because things aren't working out quite right? All right, so you want to be accurate, you want to be timely. Like, so if you're going to record things, you need to record it after it's done. If you're going to report things as soon as possible, um, and just know all the information is confidential. Okay, and so is the record keeping. So you're carrying around people's information when you've got those cell phones with the app on it, and that there is a regulation that before you ever go apply for a job, you should know HIPAA. You don't have to remember what it stands for, Health Insurance Portability and Accountability Act, but it is a regulation that provides federal protection for personal health information. So it's protecting the client, right? That you don't just spread their personal information around. It's this information needs to be confidential legally, because there are legal ramifications if you don't and you share that, like fines and jails, but also ethically and morally. So we're going to use our senses, and this is the same as for a nurse, right? We're going to use 4 out of the 5. We're going to use our eyes, our ears, our nose, and touch to actually touch someone. So what sense didn't I use? I didn't use taste. We don't taste anything. But here's some examples. So with our eyes, we could see someone cry, you could see the grimace, you could see swollen ankles. You could hear what a client says when they're stating they have pain, or hear them coughing, or that they have mucus and that they're coughing up. You could hear the gurgling. You could smell like foul smelling urine, and I want you to keep your eyes out for that. You could touch them and feel that their hands are cold and sweaty, clammy. Okay, so those are the your senses you're going to use. So why do we do this? Observing and reporting helps prevent serious problems ahead of time because we're going to catch the problem before it gets bigger. And of course, it has to be reported to the health team or the appropriate people. If if you think something's wrong, just report it. Doesn't matter if you're not sure, just report it. And learn to recognize the signs and symptoms of common diseases and conditions. So I know for some of the agencies that you go to, they have videos, like if you're going to take care of a Parkinson's patient, they have a video about it. So you'll learn a little bit more about those diseases at that time. Okay, one of the first things you have to observe is their emotional changes. So, like mood swings, depressed, hopeless, angry, um, irrational, agitated, disoriented or confused, anxious, frightening, pacing. That means walking around, they're restless. But honestly, this disoriented, being tired, is often a sign of an infection, urinary tract infection, or any infection. So these emotional changes could be physically based. Okay, there's physical changes, and they're listed on page 128 of your book. Um, but I'll quickly go through some of these, right? Increased or decreased functioning. That means they're not the same today as they were yesterday, right? Especially if it's decreased. And a lot of it is being alert. I'm telling you that with the elderly, we may not get an infection, see a fever, or take a temperature and they have a fever. But the first thing with an infection is they're not going to be as alert. Of course, if they're unconscious, you should notice that. But either oh, I'm having some chest pains, or they're cold, they're pale, they're clammy, or they're hot, sweating. They're complaining of nausea and they're actually vomiting. Oh, there's an odor, especially to their urine, but it could be to wounds or other things. If they are constipated or diarrhea, excessive thirst, a change in appetite, change in skin, a ringing in the ears, blurred vision, swelling, and any kind of rash, hives, blisters, choking, coughing, wheezing, right? We're listening, we're seeing them talk, and we're seeing them and we're hearing them. Shortness of breath, red or irritated areas, any kind of pus or drainage, change in activity level, any kind of weakness, especially if it's on one side. Okay, so the first thing is that you're observing things. The second is that you're going to report it. And those are verbal or oral reports that you're going to give to your supervisor. And it's usually when there's a change in conditions, something that is not in the ordinary. Usually it's something not good, but it could be something good too that is a big change, right? So there's two things when you're giving reports. First, you're going to want to be objective. So, but that's a factual thing. So it's exactly what you see, smell, hear, or feel, right? The other one is a subjective, and that's what the client says. Okay, so they say they have pain. We can't see the pain. We could see that maybe they're like, oh, but they're telling us they have pain. If they're nauseous, we don't see they're nauseous. If they finally vomit, we see that, but we don't see that they're nauseous. So it's always something they say to us. And it's always document it. Try to put quotation marks around it. So, or patient states, right? So it's not your opinion, it's what they say. And of course, if you think something's wrong, report it. Okay, as far as charting goes, we often call it documentation, right? Because it used to be an old-fashioned charts, everything was on paper. And so now it's also called documentation, either same thing. And I already showed you the client flow sheets, right? It tells detail of what needs to be done is on the care plan, but then the checkoff list um, that you actually do something, and somewhere your signature or your code, your password would go into an app so they know it's you. But that has to be done. So some of the things we're looking at, intake and output, possibly how much fluid they take in through their mouth, and then how much fluid is coming out. So at home care or in assisted living, it's usually just orally what they drink and what they urinate. Now, if you work in a healthcare setting, it could be what goes into the feeding tube, what goes into IVs, and then, of course, what's eliminated could be liquidy diarrhea, or if somebody had other kind of drainage bags, what's coming out. Okay, and then we probably monitor their food intake. Every client's different, so some we may, some we don't. Um, they're if they're immobile, they're not moving around. Are we positioning them? Um, Bowel and bladder, again, recording if they've had a bowel movement, right? And this way we know if they're constipated. And then their behavior, an action plan so it is sometimes we'll be documenting and looking at behaviors, especially if it's dementia patients. So every patient's different. These are just examples, and you could go back and look at that, the paper one. So even though it's on paper, that same information is just put into computers and apps. So it's easier right now to look at the paper ones we have that are in this module and that I just showed you. So I'm going to go through a little bit because your book is really written for CNA, but a hospital chart is known as a medical record. So they used to be called charts, they're medical records now, and it's a legal document, right? And we always accuracy is important. In a person's medical chart, they're going to have a lot more than in a home care progress notes, medications, x-rays, physician reports, different kind of treatments and lab reports. However, even for home care, this is very important. If it isn't charted, it isn't done. So there's a few reasons that are very similar. One is that if it's not charted, what are you doing there? Where you're supposed to be doing these activities to help that client out. And it's the same thing in the hospital. If it's not charted, it's not done, even if it is. Okay, the last is going over some charting documentation. Okay, so here's some charting guidelines, and remember it could be paper charting because we still have that, or it could be mobile charting. But be sure that the client's name and either the room or address are on each paper you document on or on the phone, right? Do you have the right patient? That happens more than you can believe. You start charting and say, oh, that's the wrong person. Clear, if you're writing it, clearly write it in ink, never pencil, right? And if it's written, you correct errors by drawing a line through the error and sign it. So you don't scribble it so you can't see it. You just put a line through it, never scribble, never erase or white out a record. If it's on a mobile app, there's different ways to say wrong client, and then you put your password in, right? Um, Chart the procedures after completing them. So don't chart ahead of time because it might not get done. Things happen. So give details if you need to. If it's not a flow sheet, something's going on, and put in the times of those details. Right. You might be there from 9 to 5, and this happened at 2 p.m. Give only facts, not opinions, and that's really, really a learning curve. Um, you can't say, oh, she's having a heart attack. You can say she's having pain, holding her chest, rates the pain a 10 out of 1 to 10, but you can't say she's having a heart attack because it could be something else. Be brief without leaving anything out. So brief is great. We don't even need full sentences. And then you either have to sign an initial, or use a certain passwords for your charting so they know it's you. And that is the end of the charting guidelines in Module 14.